Hello and welcome to this presentation about supporting neurodiversity on placement. My name is Roisin Ahern. I'm a senior occupational therapist in the UCD Access and Lifelong Learning team. So what is UCD Access and Lifelong Learning? So we in UCD Access and Lifelong Learning, our vision is that UCD will be a university for all students, regardless of their background or circumstances, feel welcome, belong, and are valued. And in doing so, students can undertake their studies and they can participate fully in the life of the university, and they can realise all their goals, whether they be academic, professional, career, and personal. And our mission here as well is to enable UCD to become a university for all, which is its ambition, where access and inclusion is everybody's business. So disability support in UCD then. So what do? We provide students who have a disability, so that would be a permanent or a long-term condition with disability support. So to do that, we carry out needs assessments with students. And that process, students submit evidence of their disability, and then they come in and they meet with a disability support specialist and carry out a needs assessment. And at that needs assessment, we recommend some supports for the student, and those would be reasonable accommodations. So they would be exam and class supports that we provide for students. In addition to that, then we also have occupational therapy. So myself and the rest of the OT team provide occupational therapy for students who need additional support. So we provide students with support, anything to do with their student roles. That might be how they're managing their academic side of things, how they're managing their responsibilities to get their work in on time. It might be around their routines, but it also might be around activities of daily living and the leisure activities, all things that feed into how they're coping as a student. So students who are registered for disability support can be referred then for occupational therapy. In addition, then we have assistive technology. So we have an assistive technology officer, and we also provide a range of assistive technology supports. So that might be equipment, or it might be software that can support students to mitigate any of the disadvantage that a disability might provide by supporting them. And we also provide support in a variety of different ways. So we schedule appointments for students to attend a needs assessment or a support review. But we also have a drop-in hour every day where students can attend without an appointment and meet with a member of the team. And we have an email address as well where students can email their queries and we can get back to them then. So the principles of disability support then in UCD. So we are trying to support students with that transition to third level where there is an increase in complexity of material. There's also an increase in responsibility that they need to take for themselves and independence. And there's a big change that often students will be living on their own for the first time or living with friends. And we try to support them with that transition to third level. We would encourage them to learn and to have those independent learning skills. So we would also encourage them the use of the mainstream UCD supports. So there are lots of supports that are available for all students in UCD, and we would encourage students to access them. We would signpost them to those mainstream supports. And we would encourage and support self-advocacy. So we would encourage students to communicate with their module coordinators. So we put their supports in place. We indicate to them where they can find their certificate of disability support. And we encourage them to communicate that directly then to their module coordinators, what they require for those midterm or in-class assessments that they have. And we would encourage them to communicate and disclose to staff directly. So we would advocate for students if they needed, but we would always encourage them to self-advocate. And part of our role then as well is the preparation for the workplace. So we would scaffold with the supports that are available, but also bearing in mind that students will be able to access supports when they're in the workplace also. So the criteria then for receiving disability support. So Students are under no obligation to disclose a disability in university. It's a protected characteristic and they are not obliged to disclose this. If they do wish to disclose a disability, then they, in order to receive reasonable accommodations, they must engage with the needs assessment process. So again, that's providing evidence of that disability and engaging with us to have a conversation around what supports they require. Once a student then has engaged with that needs assessment process, UCD is legally obligated to provide them with reasonable accommodations. So to put supports in place, students must consent to share a certain limited amount of information with UCD staff. We can talk a little bit more about what that is later. So what are reasonable accommodations? So a reasonable accommodation is any action that alleviates a disadvantage that a person experiences due to that disability or medical condition that they have. So for example, that might be additional time, and that's set nationally at 10 minutes per hour. So that might be for any number of reasons that a student might require extra time. It might be that for if they are having differences in how they process the information. It might be around the sensory environment. That might be very distracting for some students. So in addition to that we would have a common accommodation that we would put into place for students would be a smaller exam venues. That might be a smaller room around 20 students that they are sitting their exam with rather than in the larger halls in the RDS. Some other accommodations might be assistive technology provision and trainings. That might be just around accessing the accessibility functions that are already existing on many programs that we have, or it might be around more specialized assistive technology that exists, and so provision of that and then training for that. Or some other types of accommodation might be around provision of lecture slides, so for a student to be provided with those lecture slides as accommodation, if they require to maybe adapt those into a format that suits them better. So the release and disclosure of disability. So just sharing this here for you to see what kind of consent that the student completes as part of their needs assessment. So we seek their consent when they request a needs assessment that they disclose this type of information. So it's really to be able to share what type of accommodations that the student needs, and for us to be able to share them with the academic advisors that then can put those supports in place for them. So the school and programme staff will be able to see their name and student number and then what kind of exams and classrooms accommodations are available or are put in place for that student. So consent can be withdrawn at any time by the student, and we ask them to come in and sign any support review form if they want to remove their supports as well. And so they can review that at any time. And you can see there as well, we ask for the ability to disclose some information to clinical needs assessment team to look at, I suppose, what supports they have in place, but the disclosure that they complete themselves does not actually extend to placement itself. So they might just be happy for us to share with the team that might carry out a clinical needs assessment with the student, but they might then not consent to actually share that information with the placement coordinator. So what supports or information is available for staff? So a complete list and description of each exam and classroom support is available on our website. So for information around, I suppose, what kind of accommodations we put in place for students. On the website as well, we have some fact sheet and information on supporting students with different diagnoses. So general supports that might apply for students. So that's in the information for staff section on our website. And students as well can continue to link in with us and register with us for the first time while they're on placement. So we can have students that kind of are experiencing challenges for the first time, maybe when they're on placement, and they can still continue to attend our drop-in hour or to email us, and we can do that registration. So this is just a snapshot of the wide variety of students and conditions that we support students with. So you can see this is our number of students with disability supports in UCD last year in 2024-25. And this is just primary disability category. So some students might have other conditions, but this would be just their primary category. And you can see there that we have over 3,000 students that are engaging with us. And our largest category of students would be in the specific learning difficulties category, so dyslexia, majority dyslexia, and some dyscalculia as well. We also have a large amount of students that have ADD or ADHD as their primary disability. And then also mental health is another large category as well, and autism. So you can see there the amount of students that would be considered neurodiverse, or that would be a large group of students that engage with disability supports in UCD would be considered neurodivergent. And then I suppose what is neurodiversity? So as a species, we are neurodiverse, and when we talk about neurotypical or the majority neurotype and neurodivergent or the minority neurotypes, we're talking about neurotypes, which is really a distinct cognitive profile, which describes how we learn, think, communicate, interact with the world. So the majority of people would be majority neurotype, neurotypical, and then those would, I suppose, could exist under the neurodivergent umbrella would be minority neurotypes. So you can see there's some conditions that would be under that neurodivergent umbrella. So it's a range of neurodevelopmental conditions that affect how people learn, think, and communicate. So we might just go into a bit of detail then on some of those larger categories of minority neurotypes. And as a service, we would be very neuroaffirmative in our approach. So we would consider these to be things to treat or change, but we would just be about supporting students and being neuroaffirmative in our approach. So that can really encompass the language that you use and really thinking about these things in terms of differences rather than disorders. So autism, individuals with autism can have differences in their ways of thinking, learning, processing, and communicating. So there's a real, often there's seen a big, real ability for deep focus, and with that then a development for intense expertise. So really be able to develop a deep knowledge of a certain topic if it's a topic of interest. There can be differences in processing sensory information. So they might notice individuals can be very sensory seeking, sensory avoidant. So there might be some stimulation required or avoidance altogether. For example, noises or light. So thinking about that in terms of the environments. There's a lot of pattern recognition that can be really obvious with individuals with autism and attention to detail. And often communication is really authentic and honest, so lacking in jargon. And there can be a strong need for routine and repetition. So change in environments can present some challenges for individuals with autism. Dyslexia is another large category of students that we have. And with dyslexia, there's differences in processing written word, which can affect reading, spelling, writing, and often they can take a little bit longer, those activities. But with dyslexia, we often find that there's a development of really strong verbal skills, and are often very strong visual learners, or they have maybe a different learning style, and can have really enhanced problem solving abilities as well, and really creative in their approaches. So with attention deficit hyperactivity disorder, ADHD, there can be differences in regulating attention, focus, and energy. There's a real strong ability to hyper-focus on things they're interested in. So often people can really get into flow and spend a long time. And again, developing that really deep knowledge on a topic. And often with ADHD ADHD, people can be really willing to take risks, can be very spontaneous and flexible, and like think outside the box and be really creative and energetic and optimistic. And thinking about how they approach work. Often they're motivated by shorter term deadlines and work in sort of sprints rather than in marathons. And they're often really a fine eye for detail. And often they can be quite sensitive and can find rejection very difficult. So to think about how you provide feedback for students with ADHD is something to think about. So dyspraxia then, so individuals with dyspraxia can have differences in movement and coordination. So that can be coordination fine motor or gross motor. So there can be some executive functioning or planning, organization challenges that can accompany that as well. So often individuals with dyspraxia can be difficult to diagnose dyspraxia, and so sometimes they can be very creative and determined and hardworking individuals. And can be very innovative and can have real strong problem-solving skills as well. So how do we support students on placement that are neurodiverse? So up to 1 in 12 students in Ireland would identify as neurodiverse. So they're often students that are experiencing many of these conditions that we spoke about. And I suppose disclosure is voluntary. They might disclose in university and may not disclose on placement for a variety of reasons. They might be fearful of stigma. They might just to see how they get on in placement without disclosing this. And so I suppose just to approach your placement planning with that kind of universal design approach. So being flexible with how students present their learning outcomes, thinking about multiple means of engagement, of representation, so students can be able to, I suppose, turn up as they are, whether they disclose a disability or not. And really, that placement is about preparing students for the work environment, so being able to prepare them as best possible for when they enter the workforce. So we do want to support students, we want to provide them with ample opportunity to succeed, but we also, they need to learn as well, like any other student, how to do that job and how to prepare best for that career. And as I said before, students will be able to access accommodations, reasonable accommodations in the workplace as well, when they're a member of the workforce. So if something is in place for them on placement, it may well be in place for them when they graduate also. But really thinking about how we can best support students on placement. So there's some ways to think about planning, communication and flexibility. We can go into them in a bit more detail. So with planning, we would always recommend an early collaborative approach to planning. So thinking about a pre-placement visit, whether that be in person, which would be the best case scenario, so the student gets a chance to visit, to see the place, to attend under less pressure than arriving on their first day. And it gives a chance to have that discussion around what their needs are. It might be if they have disclosed a disability, if they are willing to share their certificate of disability support that looks at what supports they have in place when they're in university, in order to think about how they might apply in your specific work environment. So how it might apply to have some of those accommodations that are in place in the work. Is it possible to, for example, provide extra time to do things, to provide different environments that are quieter, less distractions to provide to do those things in, for example. So we would always recommend a pre-placement visit if possible. Even a phone call or an email exchange can often help to just ask the student if there are any additional needs that they have. We would always say once that routine is set to try and minimise unnecessary changes to routines, particularly in the start when the student is getting used to it. So that first day, where they're supposed to be, what they're supposed to be doing to try and keep that static. To provide clear, measurable learning outcomes for the student. So that might be something that they have as part of their placement. They have that set, providing opportunities to meet and to talk about those learning outcomes and to see if they're being met. To provide tasks with clear steps and checklists. So asking students, do they understand what they're being asked to do, and providing clear steps around them and breaking them down for them if possible. And it might be around the students doing that breakdown themselves, but providing them with additional support to do that. And communication, so always allowing opportunities for the student to ask questions and presenting yourself as being open to being asked questions of as well. So that can often just be about like, I'm open to this, or you can email me, or if there's a way that you prefer to ask questions, I'm open to that. But also to schedule regular check-ins as well. So there are times set for the student to meet with you and to ask questions if they need it. Providing timely feedback as well, not waiting for the student to kind of catch up, making sure that if there's something that that they're not meeting or they're not being able to, that they're not demonstrating already, just giving them plenty of time to get there. And again, thinking about that rejection sensitive disorder I spoke about with ADHD, being constructive with your feedback. Offering clear, concise instructions, and then also considering providing, for example, written instructions or a variety of different ways of having that instruction. Allowing maybe a student to record if necessary, if there's a lot of steps for someone to carry out. Consider providing glossaries or plain language explanations for any in-house jargon, and thinking about your use of language and your use of, for example, jargon or acronyms. Really thinking about making sure that you're explaining that, because sometimes it can be difficult for students to ask what does that mean, or so just thinking about your language that you're using with students. Identifying a key person if any concerns arise, so making sure that they know who to contact, for example, in college or in your workplace if you're not in, or if there's any issues. I'm thinking about the double empathy problem. So the double empathy problem is a way to describe a breakdown in communication between maybe people who are allistic or non-autistic and those who are autistic. And it describes really being communication being a two-way street. So rather than an allistic person expecting an autistic person to conform to their way of communicating, and be that body language, eye contact, verbal communication, to accept that there are differences in how we communicate and to meet people where they're at. So not to expect someone to, for example, give us constant eye contact if that's what we would do, if that's what I would usually do in a conversation. I wouldn't expect it from someone to come back to me. It doesn't mean that they're not listening or not paying attention. So really thinking about that empathetic approach, not to expect someone to change their way of communicating. So then thinking about flexibility and adaptation, where can we be flexible? So that might be around scheduling. Maybe it's not possible for there to be flexibility in the scheduling in your work, but if it is, being aware that might be something that would be a real support to certain students. I'm thinking about maybe additional breaks, or maybe if there's an hour-long break that's scheduled in, and a student might prefer to take 4 15-minute breaks if that would be possible, but how it might work for them best. Consideration then of alternative formats, so whether there might be a range of ways for a student to, again, demonstrate their learning outcomes. So maybe that might be them doing a presentation rather than writing something, or it might be writing something instead of communicating it verbally to you. It might be around doing a voice note or a short video instead of a written report. So thinking about, like, what do I really want the student to be able to tell me, and is there an alternative way for them to do that if necessary, that doesn't change their learning outcomes but rather just allows them to have that flexibility approach. Consider it as well the accessibility of any materials. So for example, the font or styles, so there are certain fonts that are suitable for students that are dyslexic, so we're thinking about using those fonts if possible, about what kind of paper we use and how things stand out. So thinking about asking and communicating with the student what their needs are. And then thinking about the workplace as well, is there anywhere that quiet spaces that you can identify, you're the person who's the expert on the placement itself. Is there anywhere that you can identify that a student can go, or anything that can be set up in advance of them arriving that might be supportive to them? And then thinking about assistive technology as well. So there are assistive technology options that are available for students, particularly on placement, for example. They might need, if they needed to type their notes, or if that is the support that they needed to do rather than handwrite. Maybe for a student with dyspraxia that finds handwriting more difficult, or a student with dyslexia that finds that they're unable to spell without spell check, then there can be laptops that are available for students on placement, and a printer maybe for notes. And there can be software for note writing and reporting on placement, for example, text-to-speech or note-taking apps, and thinking about where would that be appropriate in your place of work. So it might not be appropriate, for example, during patient or client contact, but it might be okay for a student to use that, for example, to dictate their report writing afterwards. So thinking about where, it might not be appropriate all the time, but how could assistive technology be used in certain ways within the placement. And then thinking about if there's any equipment that you can provide, or even if the student provides it for themselves, are there any environments that might be appropriate for students? So there's lots of resources that are available as well to kind of support you with managing with students on placement. So there's a head guide that talks about students with disabilities on placement, so you can get some good information there. And then in UCD Access and Lifelong Learning, we have that information for staff and supporting students with disabilities. So some of it is more within the education environment specific, but then a lot of it is really, an educator on placement also. Then also in UCD, we provide teaching on universal design. So there's a couple of different badges, teaching and learning badge, and there is the Beyond the Classroom badge, where people can learn about applying universal design across their particular setting. And then there's some websites here that have really good information and a variety of different modes, such as Neurodiversity Ireland, As I Am, which is our national autism charity, ADHD Ireland, which is our our ADHD charity, and then Dyslexia Ireland as well. So there's some really good information there on how to support people with those conditions. And then there's some sources there also. So thank you for listening today. And if you have any questions, you can email MSc Dietetics. Thank you.